Hi class, my name is Andrea Valdez and today I will be presenting you all with some information about lupus. So what is lupus? For those of you that are not familiar with lupus, it is a chronic autoimmune disease that affects your whole body. Lupus occurs when one's immune system attacks its own healthy tissues and organs because it identifies them as foreign. The earliest signs of lupus are marked by inflammation, which affects mostly your joints as well as your muscles. Lupus can cause complications in your kidney, your brain, and your nervous system, your blood, lungs, and heart. People with lupus are highly susceptible to infections as the disease itself weakens the immune system. Lupus can affect both men and women of all ages, but it is more common in women. The most common type of lupus is Systemic Lupus Erythematosus, which was described in the prior slide. So since this is the most common type of lupus, it is the one that we hear about most often. And that's because 70% of people with lupus have this type of lupus. The next type of lupus is limited to the skin, which would be the cutaneous lupus, and can either be developed from SLE, which is the Systemic Lupus Erythematosus, or can progress into SLE. This is often triggered by sunlight and UV rays from the sun. There are 3 types of cutaneous lupus, including chronic cutaneous lupus, which consists of sores on the face and scalp and can also change the skin color. The next type of cutaneous lupus would be the subacute cutaneous lupus, which causes a red, dry rash on the neck and arms, which is usually caused by excessive sunlight. And the last type of cutaneous lupus would be acute cutaneous lupus, which causes the butterfly rash, which is commonly seen on the cheeks and nose, which is called a malar rash, which is referred to on the picture from the previous slide. The next type of lupus is drug-induced lupus, which can be caused by certain prescriptions that are used to treat other diseases and ailments, such as certain medication for hypertension, medication used for irregular heart rhythms, as well as medication used to treat tuberculosis. The last type of lupus is going to be neonatal lupus. Now, this form of lupus isn't necessarily a true form, but it is seen in newborns where the baby may have a rash, liver issues, and low blood cell count, or heart block, which causes a slow heartbeat. Symptoms tend to cease after about 6 months, and they do not reoccur. So certain groups are more susceptible to having lupus than others, such as women, people of African American, Hispanic, or Asian American background, as well as people who have lupus in their family. Some signs and symptoms of lupus include muscle and joint pain, commonly seen in the knees, shoulders, and elbows, hair loss, which is sometimes a side effect of medication, rashes, as mentioned before, the butterfly rash, sensitivity to sun or UV rays that can cause rashes, chest pain, and nephritis or kidney inflammation. So some other symptoms of lupus include fever, mouth sores, prolonged or extreme fatigue, anemia, memory problems, blood clotting, and eye disease. So there's not one specific test that can test for lupus specifically. However, it can be diagnosed by a series of blood and urine tests, as well as a kidney and liver assessment in combination with several signs and symptoms that can lead doctors and specialists to a lupus diagnosis. So treatment options for lupus include non-steroidal anti-inflammatory drugs, or NSAIDs, and corticosteroids, which help with inflammation. anti-malarial drugs, which are usually used to treat malaria, which helps with the likelihood of a lupus flare-up. Immunosuppressants, which suppress the immune system in an attempt to alleviate it from fighting itself, as well as biologics such as Benlysta, which help treat active lupus nephritis. Thank you all for joining me and learning more about lupus. I hope you all learned something new from my presentation.